Good evening, team, and sorry to be late again. This Sunday evening, whole lot going on, and wanted to come on and let you know that again we will not be meeting online because this Thursday is 4th of July. So I know the last thing you want to do is be coming on to a meeting. But I did want to remind everybody that it is real important that you go to the bottom after this and read the information that I put out for last week. It's crunch time now. We have a lot going on. We have negotiated a lot of things for our team, so we need for you to go ahead and get all of those things done. In addition, I'll read a few more things off, and I'm sorry I'm in the home on the bad computer, so this is what we get. But anyway, with 4th of July coming up on this Thursday, again, we will have no online meeting. Um, First thing, those that are in the lead program that have been assigned to a doctor's office, that date is going to change from July the 22nd to July the 9th and 10th. Again, it was July the 22nd. It has changed to um, July the 9th and 10th. So you'll be receiving a call from Travis, and he's going to schedule your office introduction. What he would do, he will go with you, introduce you to the office, and set up a game plan for you there. So all the leads that you get from that office that you will be assigned to, that's not saying that you'll be sitting in that office, but whatever they come up with, when you have to they need someone for you to write up, they will give you a call. You all will work that out individually. When you go to the office, make sure that you are properly attired. If you do not have a GEL shirt, just wear a black shirt with your name badge. Make sure you have your cards so that they can recognize who you are. Sometime this week, I do have my 2-year-old granddaughter, so sometime this week I will get you the name of your doctor, the location, and all of that, so you'll have that information. So far, we have 8 doctors assigned. We have about 6 more in the metro area. We are working on some for other areas, but right now we just have those in the metro area. There are some in the North and Georgia area, but we're not taking those at all. We are looking to get some in the Macon area and in the Savannah area. So again, you will receive a chart. Uh, in this program, we will go into more details on it on our July the 18th meeting, but there will be additional funds for you to marketing funds that you can make for each plan that you do. Right now, this is not, even though we're using Clear Spring, this is not, let me repeat, this is not a Clear Spring program. This is not a HPM program. This is a GEL Health Advisors program. So don't think that your funds will be coming from HPM or your funds will be coming from Clear Spring, because it is a GEL program, we could change the company. Right now, it is Clear Spring, so keep that in mind. Additional information to come. Everyone, make sure that you complete your AHIP as soon as possible. I tried to complete mine the first day, couldn't. There was glitches in it. Had to leave and go to Indiana. Was going to sit down one night and do it. Got to number 30, and guess what? The internet went out at the hotel. So I just decided I'm just going to chill for a minute. I'm ready to take the test, but I'll take my test probably Monday or Tuesday. But go ahead and do your AHIP and get that out of the way. Speaking of that, also, if you have Clear Spring, you already have your AHIP done for 2024, please go ahead and complete that Clear Spring certification. If you need some help, send me a text and let me know. But we need as many people as possible. It's about the easiest test that we will take. So we need you to go ahead and do your 2024 Clear Spring. Now, if you're new to Medicare and you have not done your AHIP, You can just wait until your clear spring after that. When you do that one, you'll be doing it for 24 and 25. But other than that, those that are already have your AHIP done, please go ahead and complete your clear spring certification. We need that. Another thing is make sure that you complete your HQ training. Your HQ training, this is the dashboard for everything that we do under Medicare. Now, our ACA is different. Our ACA is different, but our Medicare is under the HQ. The companies that are not under health plan markets are Kaiser, um, Saunders, and it's one more, Kaiser, Saunders, and Blue Cross. Those are not on the HPM. Those are directly on the GEL services, because HPM does not have those three. And we do have a platform where we can write those three under. They won't be under the HPM platform, but if you're writing those companies, we do have a platform that we'll be getting to you that you can write those plans. Now I'm switching over to the ACA. I have been approached by an statewide organization to lead a company in contracting. It's a statewide contract for contracting about 50,000 people. It has not been finalized. I don't know all the details on it, but I say that to say this, that if you're new and have not completed your ACA, go ahead and complete your ACA, because you can start writing for 2024. You don't, but you need to do it before July the 10th, I believe it is, because they're going to close the platform down on July the 10th, and you won't be able to go back in and do your ACA. And we're going to start hopefully writing these ACAs immediately. It's not, I don't know all the details yet. I have to know all the details before I sign on to this, but when I do, we're going to need all hands on deck. Again, I will get that information to you as soon as I have it. Once you do your ACA certification, send that certificate to me as soon as possible so I can go ahead and get you contracted. Another thing that I'm going to be doing on next week is looking to see what companies that everybody on the ACA, what you are certified with. We're not going to do all the companies because some of them just not viable for the business that we're in, but we are going to do those that are paying and that are paying well. It's not going to be a problem for us to get our numbers up, because our numbers are going to go way up with or without this plan. Our numbers are going to go way up anyway. So make sure that you go ahead and get your ACA contracting done. Again, I will send you a list of your companies, and you'll need to do those. Let's going back to the LEAD program. On the LEAD program, on the newsletter, if you see down at the bottom, there is some training that you have to complete. Some of you have completed the training and told me that you have completed the training. Those leads are supposed to start generating on July 1. However, I tried to get into the platform. I have not been able to get into the platform, so it might be delayed. I'm maybe looking for the first lead to drop on about July the 8th. Really, about July the 8th, I'm looking for the first leads for those to drop. We have some more programs that we're working with, and those leads should be dropping soon. So I think that's it. So like I said, read the newsletter, go ahead and do everything there, and everybody just have a blessed and a safe 4th of July.